Hello, my name is Gianna Draper. My final presentation will be about how gender norms influence the way mental health issues are expressed and treated. Throughout this presentation, I will explain how traditional expectations affect emotional expression, mental illness rates, and access to treatment. Table of contents. First, I will define gender norms and explain why they matter. Next, I will discuss how masculinity affects men's mental health and help seeking. Then, I will explain how femininity and emotional socialization affect women's mental health outcomes. And I will also discuss stigma, global perspectives, and implications for treatment. And then finally, I will conclude why the topic is important. What are gender norms? Gender norms are socially constructed expectations of how men and women should think, behave, and express emotion. From a young age, boys are often encouraged to be strong, independent, and emotionally controlled, while girls are often encouraged to be nurturing, emotionally expressive, and relationship-oriented. While these expectations may seem harmless at first, research shows that they are significantly impacting mental health outcomes. Masculinity and help seeking. According to Adius and Malachi, traditional masculine norms discourage men from seeking psychological help. Their research, published in American Psychologist, explains that many men are taught to value self-resilience and emotional control. As a result, seeking therapy may feel like admitting a weakness. This contributes to men being significantly less likely than women to seek mental health treatment. Self-stigma and masculine norms. A study by Vogel and colleagues further supports this idea. Their research found that men who strongly endorse traditional masculine norms report higher levels of self-stigma about therapy. In other words, the more strongly a man believes that boys don't cry, the more negatively he will view seeking psychological help. This creates a cycle where distress gets untreated. Internalizing versus externalizing disorders. Research shows that men and women often express psychological distress in different ways. According to Nolan Hoeksema, women are more likely to experience internalizing disorders such as depression and anxiety, while men, on the other hand, are more likely to externalize distress through substance abuse, aggression, and antisocial behaviors. These differences are not purely biological, and they are strongly influenced by gender socialization. Rumination and women's mental health. Nolan Hoeksema also found that women are more likely to ruminate on stress. Rumination means repeatedly thinking about problems without actively doing anything to solve them. This coping style increases vulnerability to depression. Because women are often socialized to be emotionally expressive, they may internalize disorders rather than act outwardly. Sociological perspective. Rosenfield expanded this discussion by examining gender from a sociological perspective. They argue that broader social structures such as power, inequality, discrimination, and role expectations shape mental health patterns. Women show higher rates of depression and anxiety, while men show higher rates of substance use and other such disorders. These patterns reflect social expectations as much as individual psychology does. Global perspective. The World Health Organization highlights that gender disparities in mental health exist worldwide. Globally, women face higher exposure to poverty, discrimination, and gender-based violence. The social determinants significantly increase the risk of mental health disorders. This shows that gender norms operate not just individually, but structurally and culturally. The masculine self. Christopher Kilmartin in The Masculine Self explains how rigid masculinity norms restrict emotional development. He argues that strict adherence to traditionally masculine contributes to emotional suppression, relationship difficulties, and even increased suicide rates among men. The demonstration that masculinity norms can have long-term psychological consequences. APA guidelines for boys and men. In 2018, the American Sociological Association released official guidelines for psychological practice with boys and men. These guidelines emphasize that traditional masculinity ideology can negatively impact mental health outcomes if not addressed in treatment. This shows that even clinical professionals recognize the powerful influence of gender norms. Stigma as a barrier. Across multiple studies, stigma appears as a major barrier to treatment. Men may avoid therapy because it threatens their sense of independence, while women may avoid speaking about anger or substance use if it conflicts with the expectations of femininity. Gender norms shape not only symptoms, but whether people feel allowed to seek help. Why does this matter? Understanding the connection between gender norms and mental health is important for several reasons. First, it helps explain why men are less likely to seek therapy but have higher suicide rates. Second, it helps explain why women experience higher rates of diagnosed depression and anxiety. And finally, it shows that mental health is not just individual, it is shaped by culture and social experiences. Implications for treatment. Mental health professionals must consider gender socialization when working with clients. Treatment approaches may need to normalize emotional expression for men and reduce self-blame or rumination patterns for women. Addressing stigma directly can improve access to care. And by understanding gender norms, clinicians can provide more effective and cultural awareness treatment. In conclusion, gender norms significantly influence mental health outcomes, emotional expression, and help-seeking behaviors. Traditionally, masculinity norms often discourage vulnerability and treatment, and feminine socialization patterns can increase internalized distress. Research from Psychology, Sociology, and global health organizations consistently show that gender expectations shape mental health in powerful ways. Recognizing this allows us to reduce stigma, improve treatment, and promote healthier emotional expression for everyone. Thank you for listening.